Look at this picture. How many of you have a visceral response? If you do, you're not alone. Abundant research has shown that relationship dysfunction is strongly predictive of negative mental health outcomes, such as depression, suicide, other mood disorders, substance abuse problems, and domestic violence, not surprisingly. But relationship health is also intertwined with our physical health, too. For example, Janice Kiecolt-Glasser and colleagues at Ohio State brought couples into their lab, measured their levels of conflict, and created a small wound in their arm. More hostile and dysfunctional couples' wounds took significantly longer to heal over time. Multiple studies have indicated that relationship quality is significantly associated with lower mortality rates and poor health indicators, such as cardiovascular functioning, even when controlling for indicators such as income, education, and health behaviors such as smoking, drinking, and diet. And these findings are particularly true for middle-aged and elderly couples. Unfortunately, the problems are not just confined to individuals in the dyad. They radiate out to other family members. Poor parental relationship quality is linked to greater likelihood of parental-child conflict, poor child physical and mental health, and, as any teacher can tell you, poor academic achievement. In fact, these effects ripple out and widen circles of dysfunction across generations. Children of poor quality relationships are more likely to experience more overall conflict in their own marriages, and these marriages are also more likely to end in divorce. And this is a gift that keeps on giving. And if we continue to ignore this problem, it's going to reach epidemic proportions. In fact, fewer people are getting married and staying married unless they're highly educated or have high incomes. A recent CDC report suggests that instead of marriage, people are tending to live in serial cohabitations, and they're struggling to maintain their relationships. One negative consequence is that fathers are less likely in these kinds of relationships to stay with their kids. And then that creates other problems. Serial cohabitation, which is not stable cohabitation, means that there's lowered financial stability, more stress in the home, and greater likelihood of child maltreatment and domestic violence. It also may contribute to increasing financial and health-related disparities. Epidemiological evidence suggests the divorce rate is increasing and the marriage rate is decreasing at higher rates among racial and ethnic minorities. For example, among pregnant minority couples with low-income levels, only 44% will be together by their child's first birthday, compared to 76% of white couples. So given that relationships are intimately intertwined with our health, and relationship health is so important to society's functioning, but we don't think of it as a health issue, maybe we should start slipping relationship education into existing public health interventions, like we slip spinach into smoothies to make us feel healthy. Public health interventions should be widely disseminable, attractive to broad populations, brief, inexpensive, and effective, a little like the Chipotle model of fast food, fast, cheap, and good. Can we make the case that family-based public health interventions might be more cost-effective and more efficient by improving health behaviors and relationships at the same time, giving us a bigger bang for our buck? My colleagues at Duke University and I tested this idea out in a project that started out as a brief smoking cessation program for Latino males with pregnant wives. But our advisory panel suggested we need to frame it as an intervention to create healthy families in preparation for the baby and focus on both partners' health behaviors during the pregnancy, so as not to shame the men. But when we did that, we ran the intervention as a group and no one showed up. We discovered there were too many transportation barriers and childcare barriers and deportation fears, so we copied successful early childhood intervention programs like the Nurse Family Partnership and ran our program as 2 brief home visitations. That worked gangbusters. 366 couples were in the study, half randomized to the intervention and half to the control. Both got information about how smoking affects children and access to the patch. But the intervention condition added communication skills training designed to help the couples support each other emotionally and problem solve. Both the control intervention and the intervention substantially reduced smoking behavior. Just knowing how the residue from cigarettes on their skin and their clothes could negatively affect their baby motivated most of the men to quit. However, for the really heavy daily smokers, the couples intervention condition was much more effective. Also, somewhat unexpectedly, we had another finding. Men in the intervention condition reported less binge drinking, and these effects lasted 1 year past baseline. Note that alcohol was not targeted in the original intervention. We didn't even talk about alcohol. So something else might have been motivating them to stop drinking, and it wasn't talking about alcohol or the effects of alcohol. Instead, our lab looked at maybe it was the relationship. What we found is that the more the couple's relationship communication improved, in later assessments, the men's sense of self-efficacy and their motivation to change their health behavior also got greater. The more they felt supported and like a team with their partners, the more likely they were to tackle health-related changes. And going back to the spinach and the smoothie idea, our findings also showed the intervention increased couple satisfaction postpartum, which is a critical time period where every other study indicates that couple satisfaction goes down. And the more satisfied the couple became, the less depressed the mother was during that period. So we're still looking at the impact on exercise and diet and aggression, but it's safe to say that our little intervention, 2 90-minute home visits, may have had a great big impact on both members of the couple. We're now analyzing data from a larger home visit, relationship education intervention conducted here in Knoxville called Relationship RX. And so far, our preliminary rough findings are indicating again that 2 90-minute home visits are improving diverse outcomes such as relationship aggression, relationship satisfaction, depression, parenting, and even healthcare utilization. So systemic family-based interventions can have so many more effects downstream than a single targeted intervention. We all want that happily ever after ending, and I think our society would be much better if more of us could achieve it, and I think we can. So family science and public health, are they strange bedfellows or a match made in heaven? I know the answer. I hope you do now, too. Thank you.